if they feel like they're losing a service and not getting something better, and which is why I've tried to be all-encompassing with it. But I think the starting point is people lobbying commissioning groups, pressure groups. Terry Price is here from the Wickham Hospital group. Pressure groups are great, sending out emails, forming campaigns, running meetings, because it is going to be local people who drive this, but I think that the financial realities of hospitals is also going to drive it from the other side. Ultimately, though, the decision for this is the question. And without wanting to sound too disloyal, I'm not getting a straight answer from the Department of Health upon who's responsible for when the hospital decision can be made. And I think this is something which everybody in Westminster needs to reflect upon, because we're seeing a current situation with regards to South East London with Lewisham Hospital. We have an ongoing situation with South London with 3 hospitals merging to 2. We have a number of county departments that have been earmarked for closure in West London, all because of what I've described to you. I think that there needs to be a political rethink in this area, and it needs to be cross-party, because realistically it does need to involve all political parties, because this is all in our interests to get this right. But finally, yes, people. It is about people writing, supporting, and writing to commissioning groups, writing to hospitals saying, have you thought about this? In my experience, off the record, quite a lot of senior hospital managers, management board members, going, you're right, Philip, but it's not going to happen though, is it? Actually, I think it can happen, it just needs a bit of courage. Gentleman here with you.
Thank you. My name's Lee Mercer. I'm not affiliated to any particular party or any parish. I'm just a patient.
Yeah.
I find what you're doing is very laudable, and I believe we need a hospital where you plan to situate it. It's an hour to Bracknell Hospital, Royal Berks.
Yeah.
It's probably more than that to Wexham Park.
Mm-hmm. Depends on the time of day. So.
And having gone through specialist care and having to go to Harefield, my wife spent an hour and a half each day travelling to visit me.
Yeah. Another hospital that's not in an appropriate location.
Okay, I get all that, but you mentioned the fact that Wexham Park would have to close amongst other hospitals.
In order to pay for this.
Yeah, but this doesn't make sense to me at all, because you mentioned the people who live sort of north of Wexham Park and east of it go to Hillingdon.
Yeah.
That just won't happen. There's nowhere at Hillingdon to park a car now.
Hillingdon needs to get bigger.
Sorry?
Hillingdon would have to get bigger.
Yeah, there's nowhere to put it. There is nowhere.
Well, then, in which case, the point I've been trying to make, this needs to happen across the country. If you go to Cambridge, sir, Adam Brooks is growing significantly. If you go to Norwich, Norwich is a big hospital. You go to Swindon, Swindon is a big hospital.
If I can just finish what I was saying, what really needs to happen is to retain Wexham Park and the other hospitals and add this as a hospital so that it covers everything.
No.
But you're nodding your head, that's fine, because there's no money for it.
No, it's not about money, sir. Let me explain again, okay? Wexham Park is not big enough to serve the population it seeks to serve. The population it seeks to serve, it's not big enough. You need to serve a larger community of people in order to provide the level of care. The reason you had to go to Harefield, sir, was because the care that you received wasn't necessarily available in other hospitals. You had to travel some distance to get that care. Right? The reason my father had to travel into London was because that care was not available locally. We cannot, it is impossible to deliver the quality of care that you would like to have on as many hospital sites as we have. It is not possible. It isn't money, actually. It is to do with staffing. In the past, I'll give you an example. You know the sort of Justice Robertson General Surgeon of the Doctor in the House series? Well, the General Surgeon did everything. That's why he was called the General Surgeon. He operated on everything. They don't do that anymore. They're all subspecialised. In fact, even within general surgery, you will have an upper GI specialist and a lower GI specialist. And even within that, you can have subspecialties. So when you've got your problem, whatever it is, you really do want, in an ideal world, to go to the person who is the best at that. You can't have that at Wexham, and then also another one here, and another one at Wickham, and another one in Aylesbury, and another one in Reading, and another one in Camberley. It's not going to work. And the reason is that you need people to come through for that person to maintain their skills. So you need fewer sites. The other thing to bear in mind is, I've said already, the great majority of care is chronic. It's outpatients. It's physiotherapy. It isn't acute medicine. It isn't acute operations. It's chronic, and that can take place in Bracknell, that can take place in Wickham, that can take place in Slough. But if you're actually sick and you need acute treatment, you want to go to a place that's the best. There's no reason why this couldn't become a teaching hospital, for example, and thereby attract top consultants who want to teach as well as to operate, etc., etc. You could create a virtuous circle here. There's no reason why that couldn't happen. It
Can we have an opportunity to ask a question?
You know, so, of course, sir. I'm answering his first, and I shall continue.
Long-winded, yeah.
Leo, come on now.
Finished, if you wouldn't mind.
It's all right. Do you understand my point? My point is, it's not. I want to provide more care on fewer sites. And yes, that might mean that people have to travel a bit further in order to get it, and that would involve more ambulances and helicopters and things like that, possibly. Of course it would. But when you get to that site, you get cared for better, is my point. So, as you...
The microphone's on.
Holiday Inn's microphone has died.
Is it? Okay. What I'd like to ask you, if I may, Leo Walters, have you had discussion with the Highway Agency? Because when you mentioned about Handy Cross, I'm sure the people of Bray don't want another Handy Cross in Bray.
So
if you haven't had a discussion with the Highway Authority, we've fought battles year after year on not having that sort of thing. And however good this may or may not be, a thing like this, with all the infrastructure that would be required, would ruin that part of the world, and that's what we're concerned with.
Okay, so as I said, I'm not a developer, not a planner, or anything like that. This project was not a complete project on how I would build a hospital on that plot of land at Junction 8-9. It never claimed to be. It never was going to be, because it was Eva and myself, you know, in our spare time doing this. All this is about choosing a location at the epicentre of a population of 650,000 people. The particular piece of land, was brought into this discussion not by me, by the owner, by the agents of the owner.
I've been approached by that owner many times.
That's not correct.
Well, I you know, I'm not aware that in our project that we earmarked exactly the piece of land. I mean, I think we just put a cross on the junction.
That same owner has asked me many times about this very bit of land.
Yeah.
He wants to do something there. Yes.
Yeah, you're sure. So, but I must stress, please don't fixate on the plot of land. Okay. No, I'm not. Actually, sir, I've just put a dot on a map of the epicentre of the thing. Okay. You know, that's. I mean, I don't actually know where that dot actually exactly corresponds to. This is about the fact that it is impossible for us to maintain the hospital system that we have. All right? If you've got a better suggestion of the location, please.
Yes, Junction 6 is a better suggestion.
Well,
It's not.
well,
possibly.
As I said, fine, but all I'm trying to suggest to you is that the consolidation of services has to take place in one place. That place, we can probably, we'll come up with more than 2 suggestions tonight, because most people aren't going to necessarily want their view upset or their community upset, and I understand that, I'm sensitive to that.
Have you thought of an alternative if this one doesn't go through?
Sir, do you know what? It isn't my responsibility to think of an alternative.
Isn't it?
I have no responsibility for where this hospital takes place. I actually have no responsibility for whether the hospital is built or not. All of that is in the hands of acute trusts. It's not my responsibility, sir. My responsibility to my constituents is to provide the very best care they can secure.
I would have thought that would have entailed having an alternative if this one didn't go through.
Can I suggest, because there are a number of people who I think want to ask questions, there are a number of different issues being addressed here, and I suggest that we perhaps take them separately.
Sure.
The key about this tonight is the concept of a hospital, which actually involves merging two acute trusts, whichever those two might be, And there's a separate issue of where the site of that hospital would most appropriately be. So there's a question about, is it right that actually we look to have, if you like, a larger hospital that can provide, as Philip is suggesting, better care, and then there's a question of where that would go. Now, I've got an interest in where that would go, and Leo knows full well, as I said earlier, I suggested 8-9 Junction a few years ago because I actually want a hospital that's close to the people of Maidenhead, because I'm the Member of Parliament for Maidenhead. Now, as Philip has said, I mean, there are other people. He is actually suggesting something that is not in his constituency, and that's very good because he's looked at what seems to make sense for the whole area. But there are issues about traffic or plan. This is very early stage. This is not. There's no discussions with the Highways Agency. There's no discussions with planners. There's no discussions with anybody who is actually going to put a spade in the ground or a digger in the ground or anything like that. This is about the concept of what sort of hospital provision should be available locally and how we can get the best possible hospital care locally. And it's taking your views.
We're not qualified.
You've got to be careful. I mean, if we go along and agree with this, you'll assume that we agree with 8-9. Now, we may agree with the principle of another hospital. We may agree with that, but we're not necessarily agreeing where you're saying it should go. And the other thing is that I think a lot of people will be concerned about losing places like Wexham. I know there are problems there, but to rule that out completely is going to be pretty tough for people coming from that part of the northeastern part of this area to get to this particular site.
Okay, let me address that. First of all,
and Heatherwood actually is very convenient for a lot of people, particularly because it's an easy road. There's no traffic. It's an easy place to get to.
Right, so you've clearly not listened to what I've said about
the
clinical.
But you have been rather confusing what you've been saying.
So you've not listened to the clinical drivers. The clinical drivers of this. You cannot provide the care the people of Bracknell need on the Heatherwood site. Okay? Full stop. So in which case, if you cannot do that, you need to try and think of a location where it serves a big enough population so the care can be offered that my constituents need. Now, you could suggest that I've been quite brave and quite bold in not locating this in the middle of Bracknell. The reason I did was because you could not serve a big enough population at any location there because it's down here. It's rather like repeating the same stupid decision of creating a hospital at Wexham Park, which was plainly daft, and still is daft, even though they've built tens of thousands of houses since they built that hospital. We can't do it like that. Now, actually, I'm not wedded to Junction 8-9. Politically, sir, it would be much better for me if it was at Junction 10, trust me. All right? But I've said Junction 8-9 because it's at the epicentre of this population. As Theresa quite rightly says, if a different two acute trusts merge and it's different to the two that I suggested, the location changes. As I said, it's not up to me. We're not even at that stage, sir.
Can I? Well, I was going to suggest I'd seen Edna, Councillor Paul Lyon at the back, the gentleman there whose name I don't know, and another lady here put her hand up as well, but perhaps Edna first.
Thank you. My name is Edna Conover, local resident, chaplaincy team member for the hospitals around the area. At Wexham Park, just 2 days ago, I went 4 times round to find a parking place.
Yes.
Having found a parking place, I was able to get into the hospital to find the patient that I'd been called out to had actually died, which was distressing for me.
Sure.
So I think parking is a very big issue that has to be looked at, whatever plan is put into action.
You're right.
And the same applies for St Mark's Hospital, where we have fought to keep that hospital there until we have a better, bigger facility.
Yes.
Looking at St Mark's as it is at the moment, there isn't a lot of facility for development further in that area. And with the recent accidents that have taken place on the motorway, and they are constantly happening just at the 8-9 junction and beyond it, And anyone checking the traffic statistics there will know that. That is not a lie. I think people would agree with me on that. It's a reasonable place to have a major hospital, but of course it will affect people living around the area who've lived here for years, who don't want to see change. But whether we like it or not, change is coming. And we know that from the work now that is laying on our GP's shoulders, and the general surgeries right around the area. So to have a central point, wherever it is, wherever a major hospital or a teaching hospital is located, is essential for the future, in my opinion. And I'm very grateful for the work you put in.
You're right to draw attention to the parking, because Wexham is disgraceful. It's all over the road outside. Royal Berks is arguably worse. Wickham doesn't have particularly large parking areas. Every hospital site, some of this is legacy, you see, because they did not foresee that people would drive so much cars. There were more cars on the road. In my lifetime, the M4 hasn't been widened. And how many houses have been built in this area, how many business parks, how many industrial parks. So there's a real need for parking, and as I said, that would of course, that's why you need quite a large plot of land. If you look at the Norwich Hospital, you will see it's about an 80-acre site, and it's a significant parking area. But you also need appropriate bus services, and you need appropriate ambulance services, and I would suggest you also need helicopter services as well. And all of that needs to be factored in, because it's important. If you're acutely unwell, time is often significant. And if you're trying to get along little country lanes in the area, it can be very, very difficult, and it can actually make a difference between life and death. And the final thing I would say with regards to traffic accidents, clearly if you get increased traffic congestion, you've got more chance of a road accident. Not so long ago there was a pretty nasty one on the M4, sort of Wiltshire way as I recall. When is it going to happen in Berkshire? We don't have a primary trauma centre. It doesn't exist. The nearest primary trauma centre is Oxford. They've earmarked 4 primary trauma centres for South Central: Southampton, Brighton, Oxford and Bristol. And yet we have Crossrail, we have the Great Western Railway, we have the Heathrow approach, we have the M4, we have the M25. The list goes on. If you did this, you could feasibly do it. Just one example of what happens when you consolidate acute and emergency services.
Councillor Lyon.
Thank you, Dr. Lee, for coming here and giving us an insight into this wonderful opportunity my town would benefit so much for. As a little boy born in this town, I spent time going to Wexham Park, and they're getting a bit old and dilapidated up there, and I'm sure the medical staff are doing their best, but what a wonderful opportunity. We should seize on this, not be NIMBYs, and embrace this wonderful news, this doctor. I think, sir, you're the only GP MP, are you, sir?
I'm the only one practising, yes.
Right.
The other 2 have handed in their licence, I gather.
It's very nice to hear what your comments are. I embrace them all. I hope some of my friends here do too.
Thank you.
That's why I don't know.
Duncan Johnson, I'm a resident in Hollyport, and I'm on the Neighbourhood Planning Steering Group for Bray Parish. From what you've said about the medical scene, and frankly where it's built is secondary to the needs of the population. But I'm struck by the fact that you've come up with this scheme in your spare time and your colleagues' spare time, as you quote you. What is the Department of Health doing? Why is the Minister, the Secretary of State for Health, not coming forward with, here is our problem and we have to solve it, instead of us hearing as a kind of secondary thing that there is such an issue, and then getting carried away into the arguments about which site should be chosen. So that, my first question is anything being done, and forgive me, but I have to look at you as being in the Cabinet and ask you to take it up. with the relevant minister that this is an area that needs thorough investigation, medically first, and that we can then begin to address where the site should go. Now, I can see a great deal of the advantages that you've pointed out about junction 8-9. What for many years, the whole of this area has been suffering. We do have areas that are nice, but the road network is appalling. The M4 itself, due to be widened, hasn't been. No link has been made between Bracknell, yet it was designated a town 50, 60 years ago. It is appalling that the fact that people today, and traffic has to flow along the Windsor Road to Windsor, Ascot Road, through villages, through green patches, etc. There should be a change transport-wise today, not waiting for the whim or the magnificent idea, depending upon your view about the health needs. So it seems to me that if the health need problem was investigated thoroughly and potential solutions coming out, then some of the other problems that exist, transportation today and to this hospital, could be built in to help the problem, whether it be 8, 9, 6 or 10 junction. I've got a bit more license to roam because I don't have collective responsibility, so in the cabinet. So I will give you a candid answer, sir, about this. That unfortunately, my impression, and this is not party political, you get the sense also when you talk to Labour members off the record, that there is a reluctance politically to get involved with this because it's perceived to be bad politics, that it's a vote loser to be reducing the number of hospitals.